Mm-mm. No magic. No magic. Come on, magic. Come on. Come on. Come on. Magic wants ice cream. It'll totally disagree. But how do you define disagree? Well, I know my sugar levels today have been checked, and it was 6.4 on my type 2 diabetes. But with the insulin that's been administered now, I lost count how many days now. I've lost track how many times I've had insulin. I had sodium chloride. I think it was, something like 0.9 type percent over a duration of, I think, 6 hours. It was slowly, because they can set the machine to administer the amount of rate very fast or very slow. But what I noticed, and I was telling everyone at the hospital in the one of the wards, that my eye vision, due to the other type of medication that I'm on to keep my heart rate down from racing too fast at 150 something over, alarming, and I think generally the other medication that I was on, for other things for my condition, of course, MDs, medical doctors in the pharmaceutical company, they want their medicine, they want you to take it. I'm not totally anti towards it, but I could say, with up to a few days ago, I noticed that my vision started to decline again, only a little bit more worse. Because now I look at my OLED, or I look at the computer screen here, it's completely blurred, where up to up to maybe 3 days ago, I could still read the text on this computer. Looking at the OLED, which is only over there, it's a little bit blurred, and my vision could normally read that without glasses. If I use my other glasses, which are for long range, if I put those on now, they're completely useless, because the medication has affected which is behind the eye, or the blood vessels and such, the retina or such. It's affected chemically my vision. It hasn't affected my tinnitus yet. I can still hear I've got a little bit of tinnitus hissing on this side. Sometimes it's on both sides. Hasn't affected my auditory yet. But I'm fucking pissed off. It's fucking affected my vision. Talk about a trade-off. You take one thing on, and then you're going to get a trade-off of side effects. I did some research. I think it was only 2 nights ago, if diabetes type 2 and the administer of insulin can affect eyesight, and I got some good results. So there are some proof clues there. But I'm just wondering if I can fucking sue the NHS or the actual MD, because he didn't mention anything about having side effects. Yeah, must I do everything myself? Must we patients? Well, most patients wouldn't even care to think about looking up information. They just ask the doctor, But I don't really want to sue. I mean, the NHS are okay people. It's not like in America where you've got to pay thousands of dollars just to be seen by or thousands of dollars just to get a very bad cut sewed up in your finger. Here in the UK, you get it for free. Even dentist. Yeah, you can imagine going to a dentist. It'll probably cost you the price of that high-end amplifier. Yeah, ridiculous. Absolutely absurd. So, what am I doing? I'm consuming Ben and Jerry's. I'm just going to see if some sugar levels, if I can get my sugar levels back up a little bit, but they want my sugar levels low, within a 5 to 8 ratio. I might as well. I tell you, if this carries on the way this, I would end up fucking blinded because my vision would completely blur for the worse, and I wouldn't even be able to see my fucking hand in front of my face. I wear these, and these are for looking at close. They're not designed to looking across the room. Yeah, sure, I can see that focus now, but be aware if you got type 2 diabetes. I'm not sure about type 1, but if you got type 2 diabetes, if it gets diagnosed type 2 diabetes, I would take it with caution because it's going to it may mess up your vision. Like I was thinking days ago and thinking how the other medication that I was taking, thinking it's possible it's done something and it's percentage wise restored focus on my vision. So I don't need these, and I can read all the little text writing in the on the computer, and that was without these glasses. But now, oh dear, I'm trying to discipline my logic of my mind to try and send energy to my eyes to focus, and it's just futile. It's useless because I haven't got the proper intake of a balance as such. Because I think there's got to be a balance. There's got to be a balance of somewhere along the line of. I was asking the nurses. I think couldn't I skip one day of insulin, okay, and then the next day have insulin. So you girls still come around, check my sugar level, and then skip one day of insulin, and then they said no, it can't. It doesn't work that way. Ugh. You know. Oh, they're pleased to see my sugar level is 6.4 ratio. Oh, that's good. Because what date was it? I think it was. What date was I in the hospital? It was on a Friday. I think it was the 17th. It was the 17th. I think it was the 17th. I was in the hospital. That was when I collapsed in the kitchen and bumped my head. Or actually, it was not bumped my head. In the order, it was probably my legs first. They collapsed down slightly. I blacked out, and then my ass hit the floor first, and then my back and my shoulder hit the ground on the floor secondly, and then my head third, in that order. And you don't need to be an expert to be on the TV show NSI. They say, he fell down in this way because he was looking this way, and he would have probably, to the severe injury on the head, it was a total like timber. But I must have gone down in a different way. Otherwise, I would have a much worse injury on my head. So I'm just trying to take a little bit of this on board. It's not going to harm me. I'm hoping it's going to. I'm just gradually checking every now and then. It might take a few days of this. Oh, but then it's trial and error. It's probably going to take my sugar levels up again. I would rather have my sugar levels up a little bit and have my bloody vision back to where it was. Miracle. That was kind of like a miracle, like thinking, that's unheard of. I've not seen that sort of thing. I mean, my vision has been slightly, I think, blurred or slightly out of focus, normal in a normal way, and a normal sense for about nearly 8 years. And then suddenly, one day I take my glasses off and I'm looking at it and thinking, oh, my memory recall remembers, and I'm thinking, oh, I can just about read the computer, laptop fairly easy without my reading glasses. What the fuck? What the blazes? I might as well get one of those what's-its, pour this into a what's-it, and then stick a catheter on my bloody and have this pumped into my bloody, oh, it does my head in. As to say how much increase of actual focus I had restored, I would say probably maybe about 10%. For argument's sake, I would probably say I had a 10% increase. And now that 10% is lost, it's gone down probably 20%. Fuck's sake. Mm. That's still delayed. And I'm not consuming the whole lot tonight. I'm not consuming. I'll have a nibble. I've only taken off at the surface a little bit. I think I'll put this in the fridge now. Freezer. I really have got a bump on the head. Put it in the fridge, it'd be melted. Oh, it'd be like a milkshake then, of course. I'll just put a straw in it and slurp it up. Yeah, that's if I can get it through the straw. Yeah. Can't say if it's marginally improved. Might take a few days. But why can't they put in a little bit I don't know. Makes my skin crawl.